Although the current evolution of the pandemic in many countries points to an epidemiological improvement, it is important not to lower our guard. The Director General of the World Health Organization, WHO, speaking at the Munich Security Conference, once again reminded us of this. I am sure that when we met 2 years ago, when we were all facing the spread of this new virus, none of us would have imagined that we would now be entering the 3rd year of the pandemic. Tedros Adhanom Ghebreyesus began his speech. Tedros, he continues, regrets that in recent weeks there has been a widespread belief that several factors, such as a lesser mildness of the Omicron variant, meant that the pandemic was over. High vaccination rates in some countries, combined with the lower severity of Omicron, is driving a dangerous narrative that the pandemic is over, he warns. Not so, he stresses, when 70,000 people a week are dying from a preventable and treatable disease. Not when we have a highly transmissible virus. Once again, the Ethiopian biologist has highlighted the existing inequality in the distribution of vaccines in the world, with Africa at the bottom of the data. Only 17% of the African population has at least one dose, compared to 65% in Oceania, 68% in Europe, 70% in North America and 81% in South America. Ideal conditions for new variants. In Africa, he regrets, the virus is circulating almost without control, which makes it very difficult to track its evolution in the short term. In such a scenario, he warns, ideal conditions exist for the emergence of more transmissible and dangerous variants. Despite this, he insists, as he has said on other occasions, that it is possible to put an end to the pandemic this year. We can end the COVID-19 pandemic as a global health emergency this year. We have the tools. We have the knowledge. To achieve this, he is again calling for countries to address the $16 billion funding gap for the Accelerating Access to Tools for COVID-19, ACT. This would enable countries with fewer resources to secure vaccines, treatments, and protective equipment for healthcare workers. Compared to the costs of another year of economic turbulence, $16 billion is frankly peanuts, Tedros said. Learning the lesson. Finally, he stressed the need to learn all the lessons that this pandemic is leaving us at the healthcare level. Thus, to achieve an improvement in global healthcare, he considers 3 things to be essential: to increase cooperation and collaboration in the face of common threats, to strengthen systems to prevent, detect, and respond rapidly to epidemics and pandemics, and to increase funding. To conclude, he pointed out that the pandemic will end when we decide, because it is not a question of chance, but of choice. Translated with www.dpel.com/translator, free version.